We have heard that people administer aspirin for heart attack. So what is the role of these oral medications for the emergency treatment of heart attack?
You can give aspirin, but that's not going to work for the heart attack that you are going to manage, because it takes time for that to get absorbed and it will not dissolve the clot. It can prevent a clot. To that extent, these clot or antiplatelets they are called, is given for want of anything better for that acute event. But otherwise nothing like clot busters.
Do these clot busters have any side effect?
The older generation clot busters had a lot of side effects. It was available as early as 1980s. And because of the side effects, this was not very liberally used. And angioplasty came 5 years later and then picked up because the medicines were not that safe. And now we have a wonderful drug which is very effective, safe and no side effects. It is like a missile, guided missile. You give injection, intravenous, it targets the clot and dissolves the clot. And there are no other action in other parts of the body and has no side effects as such.
And what is the name of this newer generation clot buster?
It is tenecteplase, and there are 3 companies which are manufactured in India and marketed by about 2 other companies. The cost is still high, but we have been able to reduce the cost to 1/3 of the present level, and to that extent it is more readily available to patients.
So we'd like to know how you manage heart attack in your hospital and center, Dr. Mukund.
The first thing is a high index of suspicion. When you come across a patient with chest discomfort, take an ECG immediately. And if you find changes indicative of heart attack, immediately give the clot buster injection tenecteplase intravenously. That is very important. And keep the patient under observations. And you will get the results within 1 hour of the injection.
Does that mean that these patients who have received tenecteplase, that they don't need angioplasty?
Certainly they don't need it immediately. If there is an angioplasty that is planned, it is going to be elective the next day or the following day or days later. And you do an angiography and see what is the extent of opening of the vessel, and for the residual lesions or block, you can deploy a stent. So it becomes an elective angioplasty.
So doctor, if you have a patient coming from a rural area, how do you start treating them for heart attack right from their homes?
Plan is to make this drug available as widely as possible. And wherever there is an ECG, you should remember that these ECGs are most often taken to rule out heart attacks. Once you diagnose heart attacks, it's time to give this medicine. And best plan is to make this available as easily as possible, as early as possible. But for the cost, this should have been available in every village. But we are now hoping to distribute this with the help of the companies by reducing the cost and make it available wherever there is an ECG machine.
Right. So what is your experience with the use of the newer generation clot busters such as tenecteplase?
Wonderful. And we have done an extensive study where we conducted angiography 1.5 hours after the injection, and all of them opened to the level adequate to save the muscle.